I'm Dr. Anita Krishnan, your airway allergy expert at Bangalore ENT Care Centre, Karnataka. Many patients ask me, should I do a blood test or should I do a skin prick test for finding out what is my allergy? Both skin prick test and blood test are actually looking for IgE-mediated allergy disease. IgE is the antibody which binds with the antigen or the allergen and releases the inflammatory histamine and other cytokines in the system. Now, in a skin prick test, we are looking for bound IgE, which is present under our skin. Similarly, it will be present under our nose lining, lung lining, gut lining, everywhere. In a skin prick test, what we do is we put the antigens or the allergens on the skin, gently prick it into the skin and see for the antibody antigen binding, which is showing up as a little bump or wheal on the skin. In a blood test, we are looking for the free floating antibodies. Now, what happens in the skin pricking test? I would say it is like a fire alarm. We are pricking it and immediately the results are immediate. Immediately the wheel shows up. The blood test, the results take longer, and in the blood test tends to be more expensive. The blood test which is good to do is called ImmunoCAP. It has got very high sensitivity and it is normally reserved in an allergy practice only for a double confirmation when there is a confusion with the patient's history not matching with what is picked up in skin prick test, or if the patient has history of atopic dermatitis or eczema where the skin is not normal. We cannot do a skin prick test on damaged skin, or the patient cannot stop antihistamines or other medications which will interfere with the skin prick test. In these situations, a blood test is advisable. But blood test, like looking for smoke in the air, it may detect anything and everything. Now, I do see patients who come with blood test which check for 200, 300 allergens, which is not the right way to go forward, because they themselves, if anything shows positive, they may not be clinically significant. That may not be the reason for their problem, but they avoid it. And most of the time, it tends to be in the diet, or it tends to be some food allergen. The patient may not be having a problem, but when they look at the blood test, they see a higher value, they get alarmed, and they avoid a lot of food items. This happens especially with children, and then they may have dietary insufficiencies. So it is advisable to do a skin prick test under the care of an experienced allergist than do a blood test and get worried and alarmed about the amount of antigens which is showing positive. Thank you for watching.